Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation, under God, indivisible, with liberty and justice for all.
My name is Sara Kasawana. As a Health and Aging Policy Fellow, I serve in the United States Senate Special Committee on Aging for the chairman, Senator Susan Collins. We have one pillar that guides the work that we do. It is justice. When I first arrived, my colleagues had just uncovered a new global scam through the plight of a 77-year-old retired pastor from Maine, Brian Martin. Mr. Martin had been yoked into an online romance. Through a screen, he gave a lady named Joy his friendship, trust, money, and nearly his life. Mr. Martin ended up unknowingly carrying 2 kilograms of cocaine, beautifully wrapped as gifts for Joy, and getting caught in an airport in Spain, where he was promptly arrested, convicted, and jailed. Senator Collins called a hearing about the scam, which hundreds of seniors had fallen for. Mr. Martin's son testified at the hearing since his father was in prison. This was my first hearing, and I watched Senator Collins and all the members call for justice for Mr. Martin and the others affected by this global scam. Senator Tom Tillis of North Carolina promised action. Anything that we can do to move heaven and earth to get them back. For the following hearings, I sat behind the dais. A series of hearings investigated sudden price spikes in decades-old off-patent prescription drugs that are proven to be gold standard. You know Martin Shkreli, pharma bro, the guy who bought Daraprim, a drug for a parasitic infection used by people with late-stage AIDS, and raised the price by thousands of % overnight. Well, he's not the only one. Other companies followed suit and applied that same business model to extract monopoly rents from decades-old drugs. Behind the scenes, I interviewed dozens of physicians, hospital administrators, and average Americans who rely on these life-saving drugs to survive day to day. I read hundreds of pages of internal documents to understand how and why a company would exploit individuals living with diseases that are already a burden. At the end of the day, I found myself as perplexed as everyone else and came to the same conclusion as the chairman, that these companies raise the price astronomically because they can. After a line of questioning in a hearing investigating Turing, the company that sells Daraprim, Senator Tim Kaine of Virginia reasoned out loud in an attempt to understand how and why a company would, as he put it, hold patients hostage. He ended with a statement directed to Michael Smith, a young graduate of Fordham University who is co-founder of Turing. Senator Kaine said, "Fordham is a Jesuit school." Mr. Smith responded, "Correct." The senator looked back at the young man in the eye with an intensity that ought to hurt, and then shook his head in disapproval. Throughout the drug pricing investigation, I met and spoke with dozens of extraordinary Americans who called to share their stories and struggles in paying exorbitant prices to manage their diseases. These voices spanned across the spectrum, from newly diagnosed young adults scrambling to make ends meet to established grandparents with retirement on the horizon. I'm going to share the story of Berna Heyman, a retired librarian from the College of William and Mary who is living with Wilson disease, a rare genetic disorder. Mrs. Heyman had been taking Cyprine, a drug sold by Valiant, to manage her Wilson disease until one day when she learned that her copay would exceed $10,000 with her insurance covering $260,000. Mrs. Heyman applied for patient assistance from Valiant and was told that her income precluded her from support. Her story broke in the press, and then she received a call from Valiant. Now the company offered her a deal to provide the drug at no cost to her as an exception. Mrs. Heyman refused because she did not want to be an exception. In the face of a life-threatening illness, Mrs. Heyman represents the principles that we are striving for: justice for all Americans, not exploitation of most, with exceptions for some. At the committee, we work on serious issues every day. We held a hearing on serious illness care, through which I met Amy Berman. Maybe you know Amy as a star advocate in the aging space. She also lives with stage 4 inflammatory breast cancer and shares her story bravely. Her life and work provide a model of inspiration as we seek to ensure that federal policies support efforts to relieve suffering and respect personal choice. When she talks about her illness, she talks about her life. She shared with us the waterfall trajectory, living every day to the fullest up until the very end. Prophet Muhammad instructed, "If the final day comes and you have in your hand a seed, plant it. 10 years from now, I may not remember the memos I drafted, talking points I wrote, statistics I assembled, research I conducted, meetings I attended, phone calls I made, and hours I spent on language. Language for resolutions, for committee publications, and for the many documents we produce. What will I remember? I will remember the stories I shared today. They are seared in my memory. They are instances of Americans standing up for justice for themselves and for others, of senators calling out for justice for individuals and for communities, and of people allowing their inherent goodness to shine. That is the part of public service that moves me. In an era where politics is something that I no longer like to watch on television, I had a refreshing experience working for Senator Susan Collins. Fueled by strong ethics and justice, the Senate Special Committee on Aging does something every day to improve the health and well-being of seniors and all of us striving to become seniors.